everybody. Thanks for joining. Let's get the welcome slide up. I can share.
Are you?
I can try.
No, here you go. Now you can share.
Oh. Mhm.
Hi, Isabella.
Okay, is it sharing correctly?
Yes, now it is.
There we go. Perfect. All right. Welcome. We just have our slides up while we patiently wait for quorum today. Isabel, no worries. Thank you for letting us know that you have to drop at 2:30. And thanks for your quick response to the data access thing. I really appreciate that. So we'll connect separately and figure out what to do with that.
Sounds good. Thanks.
Welcome forward. Welcome, David.
Hello.
We have our new welcome slide while we wait for quorum. Hi, Gretchen. Hi, Amber. Hi, Mark. Welcome.
Hey.
Six. I think we're at five. I might still give it a couple minutes because I know we have a couple folks that I think will be able to join today. And Anna, can you remind me, are we going through all the group agreements before we do attendance or just having them up as folks join?
Kind of up to you. We read them all out in exec, but up to you. I mean, if
Okay.
people are violating the group agreements, it's helpful to remind them what they are. If the group is naturally kind of operating in this way, then you've built the culture that you
Well,
want to build, and maybe you don't
we're
need to
still
change
early
that.
on and acronyms are tough for everybody, myself included, so I'll probably read them out.
Perfect.
It's like Adam's here. All right, once Adam pops in, I'll start reading through the group agreements. Mhm. Hi, Adam. Welcome.
Hey, sorry for being late.
No worries. I think we're at quorum.
You are.
I'm counting. Okay, perfect. All right, welcome everybody to this month's Data and Evaluation Committee meeting. I'm Cody Welty. I'll be facilitating today. Our co-chair, Jackie Serrano, is also here. Andrew cannot make it today. He has a personal conflict. I'm going to go over a couple of our group agreements before we get started into what is probably going to be a packed agenda for the hour today. Um, some of our group agreements: be present and participate to the best of your ability, and treat others with respect, avoid interrupting, and use the name and pronouns they prefer. Avoid acronyms to the best we can. Use the chat to write definitions or ask for clarification. Varied and opposing ideas are welcome. Be curious when disagreement occurs. Honor those with quieter voices. Lean in or lean back. Avoid problem solving for individual situations. Connect online or offline if possible. Focus on our purpose, improving the system of care for Oregon. And be mindful of the power dynamics in the room. Do your best to avoid harming others and be open to repairing harm you may cause. All right, so we are going to jump into our attendance, and then I think we have intros after that. I don't have the agenda up because I am sharing, but Andrew Grover is excused. Jackie Serrano,
I'm here.
David Rutu.
Yeah.
This time I'm actually going to learn from our former, or not former, our fearless leader, Adam Murkowski, and I'll call two at a time. So Adam Rodakowski and Chris Barnes.
Yeah, I'm still here for a little while, man. Come on now. Uh,
Just prepping.
a present, yes.
I don't
Chris
see
is
Chris.
excused.
Okay. Amber Kramer and Will Burchard.
I'm here.
Thank you, Amber. And I don't see Will on today. Hillary Harrison and Chris Kuhn. Oh, perfect timing.
Yeah, Hillary may just be arriving.
I see you, Hillary, right as we call your name.
I did. I arrived.
Perfect. And Chris, I see you on call. Thank you for joining. Piper Block and Chris Kahn. That should be Sam Kahn. So I think that's an error in the hold on. Actually, maybe not. Nope, that is Chris Kahn. Oops. I don't see Piper or Chris on today. Jen Corbridge and Samantha Kahn is excused. I don't think John can join us today either. Alicia Cox and Mark Hammond.
Present.
And Alicia, I see you here as well. So we'll mark you as present. Thank you. I know you just joined.
Thank you.
Isabella Jacoby and Mark Greenwald.
Here.
Thanks, Isabella. And I'll double check with Mark after this, but I don't think he was excused today. We still have an open seat for E&I data or equity and inclusion data. Steve Westberg, I believe, is excused. And then Margot Cameron. Okay, I don't think she's here today. Becky Marshall, I have not added you yet to this sheet, but welcome and thank you for attending today. I see you on here. You are a voting member. And then Gretchen Morley.
I'm here.
Awesome. All right, can we get the agenda shared? And I can get us started.
Yep, one moment, please.
Thank you. Will, no worries on the audio. We can see you. If you can hear us, that's great. And Mark Greenwald is here as well. Good to see you, Mark. Thanks for joining.
Hello, and I apologize. I have to leave slightly early because of a impact thing, but I am here.
No worries. We have quite a few folks on call today, but we are a pretty new group and committee, and so I'm going to try to go through our introductions maybe in the chat. So if we can do, and we are a little short on time already, so we'll do name, pronouns, role, and I think we can call it good with that. So I will start in the chat.
Did you say just name and pronoun, no special question? You know, Adam's in the room here. You've got to be inventive.
I know. No, I couldn't come up with a special question in time, Adam. I wanted to make sure I got mine out and typed out okay before I could get to the special question. No favorite bird today.
Best bird. There's a
Best
difference.
bird, that's right.
Best bird. Yes.
Okay. We do have a pretty packed agenda for today. So I want to thank everybody for coming in. As a recap of what we've kind of done so far in the last couple of meetings, we've ratified our charter and kind of gotten set up with what our goals are for 2026. One of those 2026 goals include updating the system of care data dashboard with education data. So thank you, Isabella, for helping make that possible. And also updating it with real D data. And if we had our equity person set up, I would give them a shout out, but they're not here yet. We're hoping to join us next month. So what we're hoping to do today, we have a guest who we're working on a contract for to do the updates to the system of care data dashboard. So Reed, thank you for joining us today.
Absolutely, thank you.
Yeah, and so what we're hoping to do is kind of give a quick overview of what the dashboard looks like now, discuss what the incoming education data look like and what they are, figure out what our goal is for those displays and how we want them to look on the dashboard, and give Reed, our contractor, some guidance so that he can get started on setting that up for what those new additions will look like. These are not final. Once these updates are done, we'll come back and give a formal approval as a committee. This will probably be a few months from now, as contracts take time and so does the work. But that's the goal for today. Any quick questions on kind of what the plan is for the day? We're going to have some breakout rooms as well to kind of discuss each of those variables. All right. Giving the healthy pause. Thumbs up from Mark. Thank you for that.
That was actually pretty cool. I just lifted my thumb up and it created a thumb emoji. It's the first time it's happened. Right on.
Cool or concerning? TBD. Okay, I'm going to put a link in the chat to the current system of care data dashboard so that folks can follow along if they want to. But I'm going to start by doing kind of a quick overview of what we have and take us through a couple tabs. So, Anna, I'm going to yoink the screen share from you really quickly. So today is a feedback day for folks. So to the best of your ability, please feel free to contribute and chime in as you can. I know not every single person on this call, maybe just one, that being Isabella, is an education data expert, and that is okay. I want us to kind of think about the entirety of system of care and just as a visitor to dashboard pages, what we like to see and what will be helpful in kind of understanding our system as a whole. So you don't have to be a data expert. You don't have to be in the weeds and in the specifics. Just think about kind of as a data user or understander, how do we want this to look? So I'm going to try to zoom in so we can full screen this so we can see. Okay, this is what we have now for our system of care data dashboard. Right now I'm displaying kind of the last 2 years of data. I'm going to switch this up here to just be the last year. But this data dashboard is housed in the ODHS data office, I think is the new acronym. So I don't have access necessarily to any of the backend on this, but this data dashboard links data from behavioral health, from IDD, from juvenile justice, and from child welfare into one place where we can kind of look at who's receiving behavioral health services that's also involved in child welfare. And so we have these tabs up at the top where we can select kind of who we're looking at, how many folks are being served, what type of services are they getting in the behavioral health system. We can also tab over up here on the top to analysis for child welfare. We can see what type of services folks are getting in child welfare, how many kids in child welfare are involved in behavioral health or also involved in developmental disability or juvenile justice. And so there's similar analysis tabs for all of these. I'm going to try to move my Zoom share so I can see too. Okay. So we have similar analysis tabs for each of these child serving systems. What we'll be doing is adding an education tab up here. And so because we've entered this data use agreement with the Department of Education, we're now able to add an extra child serving system to this. And so we'll be able to link, similar to these three systems here, education as well. And so keep that in mind, kind of like the general goal of this dashboard is to look cross-system and to be able to understand, okay, are kids in child welfare receiving different types of services than kids that are involved in behavioral health? I can't go over every single analysis page on here or the intricacies of the dashboard, but feel free to fiddle around on your own time if this is something that's new to you, or if you're one of our state agency partners. Thank you for your work in helping get this together in the first place. This is a great resource that is used consistently by myself, our local systems of care, and some other folks across the state too. So it does get a lot of visibility and a lot of use, and we use it as a good data product to look at as best we can what's happening cross system in the state. I'm going to stop my share here. Maybe we try to get back to the agenda. That is the 30,000 foot view of what the dashboard looks like now. Okay. As I mentioned, the dashboard has this overall goal of really trying to inform in as best a way possible the public about the statewide system of care and how things are linked across system. And so as we add this new education page, I want us to think about a few different questions for the incoming data that we will have. And so I'm going to paste for now in the chat questions that I would love to answer for each incoming variable as we look to build that education page. And let's see if these will paste as well as I want. Okay. So the three questions we're going to try to answer for the variables that I'm going to put in the chat as well are: what questions do we want these new visuals to answer? Do we need one visual display or multiple displays for each variable? And what is the simplest version that we could display for folks? And what is the most complex? So kind of two different ways of thinking here. And then I'm working on my copy paste skills. Okay. And these are the primary variables that we will be working with. We have discipline incidents, student hasslessness, December special education child count, cohort graduation rate, and then attendance. And I think that is it in the agreement that we'll be able to get to today. So the plan for the next maybe 20 to 30-ish minutes is we're going to do a practice run on how we want discipline incidents to be displayed. And then we're going to go into some small group breakouts and try to figure this out for each of these other variables as well, and then come back and report out. Hillary, I see a hand up.
What are we getting as the cross-cutting data? Do we have it split by age and by county of residence, or what are the cross-cutting things we can think about too?
It should be linked. And so we should still have county, we should still have I think we have gender as well.
So it's going to link to an individual record.
Yes, they link to
great.
individual records. Yeah, just like the rest of the dashboard. The displays they're more limited than the rest of the dashboard because it's FERPA protected instead of HIPAA protected, and so we can only go down to I think 10 as our smallest number. And so there'll be a little bit less specificity, but we will be able to have these linked by Medicaid IDs, which is great. That was the goal.
Thank you.
Can I just do this is Gretchen, just a real quick follow-up. The 10, I assume, is the numerator. Isabella or Cody, do you know, are you also running on the 50 denominator for a group?
Our standard suppression is 10 in the denominator.
10 in the denominator. Okay. It's just that OKID is way less generous.
Yeah,
Okay.
we negotiate different things for different contracts, but
okay.
Denominator 10 is our standard, and then suppressing high and low percentages as well.
Okay. Yeah, no, that's helpful because that makes a huge difference, particularly in a lot of these subpopulations. So that's good.
Yeah.
As these get displayed go ahead. Sorry.
I would say it just depends a little bit on the number of intersections of data and the sensitivity of the data, like how identifiable we think any particular group might be.
And I don't want folks to think that this is our final decision. And so if we pick one, or if we pick a visual idea, it ends up having a lot of small numbers and suppression, and we don't really get to learn anything. That's okay. We can come back and change it. These aren't going to be set in stone after our decisions today. The goal is mainly to give Reed, our contractor, a good sense of direction for how to build these out so that we can come back and take a look at them and improve them as a group. So I'm going to kind of get us started. Actually, I'm going to pause again for any more questions if we have them before we start this practice run. Nope, Heather raised your hand again.
Sorry, one more question. So you said it's going to run on Medicaid numbers, so you're only going to cut it at the Medicaid population, even though presumably you're getting the whole population. So we're not going to get an overall view because I know, like the
Correct.
ODDS one covers the whole ODDS population. So, but we're not able to do that with this data. Okay, that's
That is
just
correct.
interesting. It's just going to be interesting to make sure people understand that as they navigate through the dashboard, but it's better than nothing. Well, it's a lot better than anything. I think it's great. Thank you.
No problem. And that's something that we can put on the a list for read as well. I have a kind of a follow-up question if we get through those three that I put in the chat of what changes would we like to make to the dashboard. I would love to make it more obvious that we're really looking at claims data for education or for other areas too. Okay. Let me get this prepped and ready. Okay. So for discipline incidents, there's a couple points of data that we are getting, which is SSID, and I'll put this in the chat as well. School year. Ignore my spelling, I am trying to type fast. Okay. Those are the data points that we'll be receiving for discipline incidents. So we have SSID, school year, discipline action type code, and the number of incidents within the type of year. Now, I don't expect folks to be experts on education data. I know I would not consider myself one of those by far. But when we're
Cody,
looking at
sorry to be
yes.
that person, but what does SSID stand for? I genuinely don't know.
Oh, it's our linking variable.
Secure student identifier. It's
Secure
the
student
version.
identification. Got you. Thank you.
Yeah, it's our ID that we track students across our data systems using.
That one will not be displayed for obvious reasons. No need to link folks' actual IDs. So we're looking at school year, discipline action type code, and number of incidents within the type in year. And so kind of as a group, if we can think back or if we have the dashboard pulled up on second monitors for how we have displays for some of our other child serving systems, like our child welfare display. Mark, that is a great question of how many type codes are there. I do not know the answer to that. And so that's something that we'll kind of get into as we feel out the data a little bit more. Isabel probably knows.
There are three. We track in-school suspension, out-of-school suspension, and expulsion.
Thanks, Isabella. I'm very glad you're here for at least these 30 minutes.
And this might be a criminologist asking the wrong question for education, but is there an offense code? Like we've got what we did with them, but is there something that tells us what they did?
We do capture that, but I don't think it's part of the data
Gotcha.
agreement we have.
Okay. So the questions that I would love for us to kind of discuss as a group are, what do we want the visual for discipline, or what question do we want this visual for discipline to be answering? And do we need to have one display for it or multiple? Is there a simple version that we can display? And what would the most complex version of this display look like?
And is that a conversation we're having in this room?
I hope so. Depends on how chatty folks are being. And so after we kind of go through this specific variable, we're going to break out into some smaller groups where hopefully it's a little bit easier to discuss and chat for our next variables, which are houselessness, special education, cohort graduation, and then regular attendees.
Gotcha.
Mark, I see a hand up.
Yeah, I clapped instead of raising my hand. I don't know how to use these things. So you're asking like in terms of the layout. So for example, I've got the dashboard up and it's got the view of youth and juvenile justice. and then also youth served in behavioral health, child welfare. And so like talking about like adding a column, also kids that had in school suspensions, out of school suspensions, that were also served in those systems. Is that what you're asking?
Yes, here, let me share again, and I'll try to make it like so. What we will have, like how we have this for child welfare now, where we have about 5 different visual displays here. The same for behavioral health. We have, I think, 1, 2, 3, 4, 5 little displays. We'll have our own page here for education that will have analysis and demographics. And so the question is, what 5 visuals do we want to help figure out what is happening in the education system for just general youth, for youth that are involved in child welfare, for youth that also have intellectual developmental disability, for youth that also have juvenile justice. I think I could have explained this much better the first time, but hopefully that makes sense for folks. I kind of live this every day, and I'm trying to be better at the explaining part. Alicia, I see your hand up too.
Thanks, Cody. So then are we trying to help determine by some of the items that you listed in the chat and other data pieces or components that could overlay with what you've already suggested? Or is what you've suggested just kind of the opener to help frame up a conversation, but may or may not be included in these displays?
Great question. The variables that I put in the chat are the ones that we have received from ODE, Department of Education. So those are at most what we're able to get and work with. The specifics within those, I'm not quite sure. Like, how do we want to display those discipline incidents? Do we want it to be broken out by each individual one? And if it's possible, we can try to work through it and do it. And if it's not, we'll come back and try to figure out a better solution.
I'm wondering for these data points are listed, such as discipline action, number of incidents, etc. Are you framing up this cohort of youth that are in school in Oregon, or born in Oregon, the way of the population, the children that we're looking at, that are more likely to be engaged with other systems because they're not getting the support they need in an education space? Or are you trying to determine some of the other factors and influences? I'm just trying to better understand why these particular items are here, unless we're for sure looking for that pathway into juvenile justice, which we don't want, and then the eventual inclusion in child welfare, which we don't want. So I'm just trying to better understand some of these data points and how they're really focusing on kind of the behavioral aspects and lack of supports and acute behavioral needs or educational needs that the child might or youth, young adult might need in this space versus some of the deficiencies of the system.
That's a great question. Anna, I could see you nodding along. Do you want to take this one? And
Yeah, and I'm sorry, Alicia, is that how I pronounce your name? Okay. That's the intent, right? So with this dashboard, like you can look at, kids in one CCO or kids in one county and sort of look for kids who are multi-system involved, and we're sort of looking for that same overlay for the public education system. So we're not looking at every student in public education, but we're looking at those who are likely to be multi-system involved and therefore likely to experience discipline, houselessness, right? Like, and we're really trying to look at when we're isolating a population, like are we seeing as we're with the functionality of the dashboard, right? We can isolate it to county and then as a primary system and then secondary system involvement. So are we seeing outliers in a geographical area that directs us as a state or as a region to say, yeah, what's happening here? Maybe something really great is happening here. We're seeing way lower numbers with discipline incidents with multi-system involved kids in the school. Can we go look at what are they doing right? We're seeing way higher rates of discipline incidents for kids who are also experiencing developmental disabilities. We'll probably see that in a lot of communities. Does that indicate some sort of policy or practice intervention that we need to be making because we're able to now sort of link these data across systems and say it isn't necessarily prescriptive, but it gives us a place to go look more deeply at those intersections between systems, Alicia. So that is like entirely the intention, right? Kids who are receiving these services and supports are having these specific experiences in schools. Does that mean things are working or things are not working? And then what do we do about that, right? That's the intent, is it gives us a direction to sort of focus our intention.
Got it. Thank you. Appreciate that, Anna.
I'm going to go next on my hand raised list. Well, Anna, was that to answer? Or do you also have a question?
I was not raising my hand to answer Alicia's question,
Okay.
but now I don't even remember why I answered my hand, and it might have been to kind of make us a point similar to those lines. So let's just call it good and
Okay.
move on to Hillary.
All right. Oh, Hillary,
Who's
you're
going to
on
have
mute
to
now.
unmute before we can hear her
I
question?
am. So things on the dashboard that I use repeatedly are a lot of the pictures in the top line that gives me the percentages so that I can see the 5.9% of child welfare or whatever. So that top line is really important. And then similarly on the OHA page, I found it really useful to have the similar graphic that you get bottom right, which is the one for the youth served by behavioral health with emergency department, so that you have behind it the picture through time as well as the percentage. I find that useful for communicating with people, to have that ability to look across time and have some kind of percentage that talks about what's happening for those systems. And I can see that if you were seeing disparities in IDD individuals and discipline, for instance, when you can see that it's a larger proportion of the population, or you can see that, since COVID, everything's gone up. Those things are just useful to have as the background grayed out across time piece that I've found useful. And then the other one would be just some kind of bar chart that allows me to see or 3 lines, whatever is the most easily read would be helpful if there are 3 lots of discipline categories that we can look at. And I presume then I'd be able to click on a button that said child welfare, and it'll again provide underneath the lighter gray version of this is the thing that you're showing, which
That is the goal. Yes.
again would be helpful. Thank you.
And Hillary, that's great. That's like what we're hoping for today, is like, here's what's useful, how I would like these visuals displayed, and Reed can take that and run with it for our first draft. So that way he's not starting kind of in the dark of what do people use on here, what's the most helpful in that. David.
Yeah, just following up on what Hillary said and Anna said. So if the goal is to really be able to identify, say, outliers, to be able to say, hey, there seems to be a lot of kids with developmental disabilities who get disciplinary actions, then I'm wondering about what we put on the y-axis. Because if it's just a count, then it's really hard for me to make anything of that data without knowing sort of whether this is a disproportionate amount. And Hillary was talking about using the percentages. Maybe my math skills are not as strong as hers are, but I mean, that requires an extra calculation to be able to see whether some group is really disproportionate. And I wonder whether having something different on the x-axis, like a ratio, or even though it's more complicated, it actually is more meaningful, because then you could identify when people are, when it's a large or a small number. A count doesn't give you that.
There's a really
Great
good
point,
point, David, and that's a challenge that we've had with this dashboard before. So, Cody, I don't know where you were with there you go. For down here, when you look at this youth served by behavioral health, the bottom left-hand corner, the little tile, it says outpatient 99.9%, inpatient 1.8%. Sort of an artifact of how the visualization works. If you're not a person who has much data maturity, the fact that those two gray bars are similar may make you think that 99.9% is similar in size to 1.8%, right? So to your point, Dr. Ritu, if we're making a ratio, we're helping people not have to do as much math in their heads. And I don't know, Reed, if that's something that we can do, but thinking about the percentage or the ratio of the population who's involved as opposed to a simple count of the population would be really useful if we have the ability to make it work like that.
Just follow up, because for the mental math, as I call it, part, what's the number that specifically you're trying to avoid having people do in their head? Just to paraphrase.
Just like when we're looking at, for instance, this top line, youth served by behavioral health are also served by developmental disabilities. So 8% of the youth served by behavioral health are also getting developmental disability services.
Yep.
Like thinking about how we're putting those, that is a ratio, right? Instead of saying of the 64,539 youth served by behavioral health, 2,000 of them are being served by developmental disability services. Like that's a mental math that I think is not helpful, right? Putting it into that percentage is helpful. So that's like an example where that's like help. That's the way we've got it is actually more useful than the way that it used to be in some places.
Sure. And yes, and in general, I think there's opportunities for some of these as well, just depending on how like big or small numbers you want to have, is to either show one or the other or both. But to your point, is whatever is shown should be generally the output number that allows for a decision to be derived from it. Anything else is supplemental to give further context for a few of those. So that's always my aim generally for ratios, because they're the best comparatives anyways. But like if needed to, there are definitely ways to be able to show like stacked or adjacent, both like values as a ratio, but then like actual values if you would want to include them anywhere, just as an FYI.
Gotcha. Thanks, Reed. And I'm going to stop talking so much after I say this one thing, which is we talked about it, this being an opportunity to identify potential outliers. There's also the opportunity to identify trend lines, David. And so dual purpose, I think, from the standpoint of the intent of how we display the data. Is there a trend going up? Is it going down? Do we want it to be going up and going down? So that's the other sort of helpful visualization that I would want to prioritize.
Okay. So I think I had this set up for breakout rooms, but I might pivot us because I think there's enough discussion from the larger group, and I want to make sure that we're kind of tracking everything, and we're running a little bit shorter on time. And so I think I'm going to move us away from breakout groups, as long as folks still feel good about kind of leaning in with feedback if possible. I think we can handle the rest of the four in this larger group we have today. Is everyone okay with that, or does someone really want to hop in a breakout room with a few other people? Give like maybe a wave for our breakout room enthusiasts. Okay, perfect. Thumbs up for staying in. Okay, I'm going to move us to our next variable, I think. Let me grab that, which is student houselessness. And then I'm going to put the couple data points that we have in the chat as well. In hindsight, I think it would have been easier had I like done these in slides. I was anticipating breakout rooms, but that's okay. We're going to make it work with what we got as true professionals here.
Can I just ask, so I presume houselessness is the McKinney-Vento information?
I believe it is McKinney-Vento.
Because that's
we have. Go ahead, Adam.
Oh, well, that'll by default catch every foster youth, right?
It should do, shouldn't it?
Yeah.
So that's going to just be interesting with the child welfare numbers.
But then I guess we should be able to match child welfare numbers, McKinney-Vento numbers, and then subtract the number of foster youth to get the other N of youth without housing.
Jamie Hewitt, who's our dashboard build, not necessarily dashboard builder, who does the data over at what used to be ORA for this. He'll be doing like the linkages, and so he'll be able to make sure that it's matched. I think I should be 1-to-1.
Great, but just so you know that you'd have to turn off. It might need a little bit of thought.
Okay.
To ensure you don't end up with a double count or something weird.
Yeah,
We'll make sure that we do that.
I'm not as confident in knowing if there are other populations in McKinney-Vento that would apply also. I don't think so, but yeah, the only context I have for McKinney-Vento is youth and foster care.
Okay, we can do all those double checking kind of after. Um, and I don't think we need necessarily the super detailed specifics for how the data are exactly going to be coming in. But what would be useful to display here with these like unaccompanied youth flags and our nighttime residence codes? With some ideas that just popped to the top of my head. It's just honestly raw count of how many youth um, at a certain timestamp. I think that would frankly be probably the simplest and might work the best just to get a good indicator. And I'm going to paste our questions that we're kind of thinking about as we discuss this again too, just so it's a little bit closer to the chat.
How often do they take this data? Is this the point in time count or an annual one? Because I mean, I love a good line graph, but it may make more sense if it's point in time to do it as a bar chart for the dates when you've got it, so it doesn't look like you've got ongoing data in a monthly way like you are seeing on all the other pages.
Line charts
To
are
your
usually
point,
good when
Hillary.
you have highly detailed data, like it meaning like granularity at like weeks or days where there's maybe like hundreds of data points or even dozens. But yeah, it looks like you have 10, 12 periods. That could easily be a column or something else. Or you could even shrink the height just because 60% of the chart is just empty. So it's not utilizing the space as well as it could.
Yeah.
Yeah, so I would either recommend at a minimum doing like a filled line chart, which at least pushes the color down, and or honestly like a bar chart for this would be perfect, or a column chart would be perfectly fine for either of these.
Okay, read that. That's perfect. For like when you go out and are building it,
Yeah.
that'd be great. I think that's where we can use some of your expertise as well on the data viz. For the rest of us that are in here, do we have any other specifics on kind of what we want this houselessness visual to answer? And do you think we can do this in one display?
I think in general, oh, go ahead, Jackie.
I was curious on with the dates, you would have to break it down to have it month to see each month about like if we looked at houselessness, you would have to look at how the trend would go over month by month. Because this says like in this example, the year served is 64,000. I'm curious on like being able to see that month over month about whether the access to services is dropping the houselessness or if there's an easier way to see how that trend goes out throughout the year. I mean, I can see youth served by behavioral health at the bottom, but it just seems like it would have to be that would still be a similar visual, or possibly having that same visual would be helpful.
Thanks, Jackie. Appreciate the feedback. Alicia, I know you had a question too, or a comment.
I was just saying, for data simplicity and data kind of literacy and like digesting large chunks of data, 64,000 is a large number. So Hillary, you and I think tend to be on the same track. But could it be monthly or quarterly? So it'd be a smaller chunk that we could process. And then if it's being compared to something, is it a ratio or a pie so that we can process that it's connected to each other as part of a whole? But having trend lines, I think, are important, but also want to maybe lay it with another factor if we're able to, and that way people could unclick or click it. So that could be an option. I know we're trying to keep it simple, but that could be another option to help give us more insight into the population being served.
That's a great question and comment. For the dashboard as a whole, we can break it down into multiple months if we wanted to. So I can have it display just from November to January of 2025 to 2026 if we chose to. I'm not sure on how frequently the McKinney-Vento houselessness data is collected, and so this might have a slightly different display, and we can work through that kind of when we get there, just to make sure that what we're displaying is accurate and doesn't kind of imply the same timeline as every other piece of data that we're using.
So this is Gretchen. Isabella is not on the phone?
No, she had to drop,
Oh, okay.
unfortunately.
My understanding is that it's annual, because we have we get the same data in OKID, so it's not something that you would be able to break down. And then if you're getting like the type of houselessness, it's the sort of first sort of observation of the school year, even though they may move into other forms of housing throughout the year. At least that's how we get the data. So you should confirm that definitely with Isabella that you're getting it in the same form. And then just listening to this, Cody, the one thing I kind of lost where we were going on this in the sense of like the objective of, and I'm trying to like think about the fact that like your dashboard compared to the kind of some of the things that OKID does, that some of it is like understanding who's on the program, but it's more about tying kind of characteristics of a kid to an outcome, which a lot of the educational pieces that you've collected now, like they're the sort of outcomes that we tend to talk about. And so I guess the question here is, are you interested in, say, looking at the group, like the population of kids who experience discipline, for example, or chronic absenteeism or whatever, houselessness, and then understanding what programs those kids have touched? So you're sort of trying to break down that population. Yes. Which gets you a little bit away from like the comparison of like the proportion that we're on this. Right? Anyway, it's kind of trying to figure out like just the makeup of that group of kids. If that's the goal, that's a little simpler. In terms of the display, versus say trying to kind of look at it from the like, of all Medicaid kids, these kids, this proportion of Medicaid kids have these traits. You know what I mean? Like it's kind of like which way are you flipping the data here to get to the data points that you're looking for that are the most actionable. And I didn't know if you had a clear answer to that. When you're talking about trying to like build out a display or have a separate display, I was missing sort of the connections.
Great question and need for clarity there. Totally understand that. The goal is just kind of looking at the more simple version of what you described, which is our kids that have that discipline incident. What's almost the ratio that are in child welfare or ratio that are in IDD or juvenile justice. Getting time stamps on this has been a lot harder, and we can't really tell if they were juvenile justice involved before they had the discipline incident or not. We're not going to be able to. Yeah, that is a separate analysis that this group will hopefully review, maybe in 9 months when it's done. Unclear. That's a project that's been going for a long time. But it is the more simple version of that. We're just looking for kind of point in time ratios where we can.
Yeah.
Okay, I know we're getting dangerously close on time. I think underestimated the amount of discussion. And so thank you everybody for being excellent on this. I will confirm with our co-chairs whether we want to continue this or if the information that we've gotten kind of for these first couple variables will be enough that Reed can take it and kind of apply it to the next variables. Because I think a lot of the feedback will be fairly similar as we get to some of our other ones, which are just special education, cohort graduation, and attendance data. And again, this isn't our last chance for feedback. There will be plenty of opportunity, and perhaps we do that in like offline feedback sessions so that people can get a good visual of what we might be bringing to the group, and looking for approval and what other ideas we might have.
I'm
in the last
really
interested. Oh, go ahead, Hillary.
Just as a last comment, I'm really interested in the special education child count and being able to see it against juvenile justice and child welfare to check for disparities around that. And I'm not sure whether some of those things would we then want to put a button onto the page that's to do with that system. You know, where do we iterate it back into the other systems? Because I'd love to see that on the IDD page, for instance, potentially. But I think until you've built it the first time, we're not going to know whether there's no problem, and so therefore it's a non-conversation. But I think if some of them become really obvious conversations, which we don't know right now, because we don't know what we don't know, it's some of it's hard to tell where to put which picture.
That makes sense, Hillary. And we should be able to, for instance, while we're on this developmental disability page, just how we have our secondary systems here for behavioral health, child welfare, juvenile justice, there should be another button here for education when it's in the display. We'll be able to filter into that as best we can. What exactly that looks like yet, I'm not sure, because we have education info for pretty much every kid in the dashboard. And so we'll have to figure out how that filter will actually work. And that might take a little bit more time.
Wonderful.
Okay, did I miss anybody's comments that are in the chat? I tried to track. Okay, David, I see yours. I'd also suggest orienting variables that will be presented together in the same positive negative orientation. Oh, that's a really good point. In other words, we present graduation rates, present the number of kids who attend regularly rather than kids who are chronically absent. That is very helpful feedback, and I think will be really good for the displays. So thank you for that, David. Okay, I'm going to stop sharing this because we need to take a second for public comment. I don't know if we have members of the public here, but if you are a member of the public, now is your chance to provide some thoughts, comments, or feedback. All right, not hearing anything from anybody who may not be part of the committee. Next month, well, first I want to thank everyone for being here and for a great discussion today. It was nice to see some folks who I haven't seen in a little bit. So thank you for joining and being a part of this really good group of brains and tough data decisions cross system. Each of us individually do not have the collective cross system knowledge that we all do together. And so this is one of those tough scenarios where we really do have to rely on one another. So thank you for bringing your expertise to the table today. Next month, what we can expect is Paige Snow, an analyst within OHA, is going to be bringing a data update and data report for, can I remember what EPSDT stands for? Early Pediatrics Screen. I was close.
Early periodic screening, diagnostic, and treatment.
Yes.
Thank you for the rescue. And so we'll be listening to her report, providing thoughts and feedback, and then I'm going to collect any volunteers for a little mini working group in collaboration with our program and policy committee, because that work kind of touches both committees. So it's our first committee team up next month. And so look forward to that and look forward to everyone's feedback. Please complete the post-meeting survey. Let us know either how we did or if there were other opportunities that were missed today. Any questions before we go?
Nice job, Cody. Good pivot. Well done, sir.
Thanks, Adam. I am on this team for the data flexibility. I don't think Anna would have hired me were I just rigid mind. All right. Reed, I'm going to send you a follow-up email too, and we'll probably have to connect offline. And I know Isabella's not on here anymore, but I have to follow up with her about some contract stuff too. So, all right. Thank you, everybody, for joining today. Very much appreciate your time and your brains. Have a good rest of your day.
Thank you. You as well.